Assalamu alaikum. Ladies and gentlemen, we have among us a very renowned personality from the public health background in Pakistan, rather one of the most accomplished public health professionals in Pakistan, Dr. Sania Nishtar. Dr. Sania, thank you very much for sparing your precious moments for this interview.
Well, thank you for coming and thank you for asking me. It's always a pleasure to interact with LEAD, colleagues from LEAD.
Thank you. LEAD Pakistan, with the financial assistance of Packard Foundation, is embarking upon a project called Women Leadership in Reproductive Health and Development. You see, conventionally, organizations have been engaging with the partners that are more inclined towards service delivery, clinical terms, or advocacy and social mobilization in the area of RH or SRH, sexual and reproductive health. So the basic purpose of this project is to raise the RH status within the unconventional partners. And three caucuses have been formed, including one including this MDGs and health, the other being climate change, population and health, and the third caucus being leadership, innovation, and entrepreneurship. So the purpose of this interview is to just seek your advice, rather your perceptions about the leadership challenges in the context of MDGs and health in Pakistan.
Well, I mean, this is such a huge subject. I don't know where to begin because I mean, leaders play different roles at different times, and if you project a leadership role in the current environment of reproductive health, and I suppose not just reproductive health, in the broader ambit of whatever is happening in the social sector and the health sector, and with reference to social outcomes, there's just so much that leaves to be desired. I mean, there's just so much that needs to be done. So, of course, there's a leadership vacuum in this area because the basic norms of social sector delivery need to change. And there's a huge leadership void. There's some. I mean, you really have to, if you have a stack of cards in your hands, and if there's been a way of dealing them in a certain way, and if you've been dealing it for the last 60 years, and now is an imperative to deal it in a very different way. And you require leadership to be able to conceptualize things, to be able to plan them, to be able to have the ability to get them implemented on ground. So, you require leadership with the head high up in the air, so that you can conceptualize, think out of the box, innovate, strategically plan. But then you also require leadership with feet on the ground, so that you know the smallest nitty-gritty of how to develop indicators, how to reconfigure implementation mechanisms, how to track progress. And you require leadership that is honest enough to say the right things, because so many norms have to change. I mean, I'm looking at the bigger picture here. I'm not worried about the nitty-gritty of a few small changes that haven't happened. Because if you look at the broader landscape of what is happening in the social sector and in the health sector, and particularly in the stream that is of relevance to you.
Well, in your response, you mentioned you pointed out towards innovation and conceptualization, and perhaps that is very much pertinent to that group of people who are at highest level of policy making and giving the strategic directions to the development efforts in this country. So maybe it would be more pertinent if we ask how to inculcate this leadership skills or values, and how to approach those leadership.
You see, with reference to development efforts and with reference to the changing environment in Pakistan, and when you extrapolate the role of leadership within that context, there's some very clear imperatives. Because in the post 18th Amendment devolution situation, there is so much that has changed. I mean, it's fundamentally shaken the premise under which business was as usual in the past. So the prerogatives of the federal government, the provincial government, the district government have totally changed, and you require leadership to be able to put some sense into that, because the 18th constitutional amendment was a broader brush change, And now the specifics of that have to cascade into implementation. And if they're not going to cascade into implementation in the manner in which they're supposed to, there is going to be a backlash. And we've just seen a backlash. I mean, Pakistan has been dragging its feet on the issue of creating the Drug Regulatory Authority. There was a bitter political rivalry between the federal government and the largest province. You know, the determinants of that is something that we all know. I needn't go into the details of that. And that has come to haunt us in the shape of the appalling 170, the most tragic deaths, which were totally unnecessary. If the oversight had not been eroded, if even the drug regulatory arrangements that were previously in place, which by the way left very much to be desired, perhaps such a blatant oversight would not have happened. And this is just one illustration of the lack of leadership and the costs that you have to bear. So clearly, across the development domain, this is a time for leadership, because you really have to appreciate what the 18th Amendment has done. You have to appreciate how to retain national roles in a changing context. You have to take stock of the critical gaps at the provincial level. You need to make sense of the local government system in terms of how it interplays with the changing federal-provincial context. So I don't see how that can happen unless there's some very technically astute understanding of the changing dynamics right at the very top level. I mean, we all know the challenges in the development sector. We all know the critical gaps, and the failure to meet certain international targets, such as the MDGs, of which RH indicators are a part, are illustrative. So exercising leadership skills to bring the 18th Amendment Pandora to fruition in a desirable manner is of course one part of what is desired in terms of the question that you've posed to me. But then of course there are very many other issues related to the lack of accountability, related to the pervasiveness of graft, related to 100 different issues that I could enumerate for you over an hour that need to be sorted out. And that's not going to happen unless the right leadership is in place.
Well, your response indicates that there are a number of perhaps stakeholders need to be engaged at the federal level and the apex bodies within the provinces. Within your response, in the first responding to our first question, you mentioned about lower levels of management as well. And you pointed out, for instance, towards the M&E monitoring and evaluation and indicators development, etc. What do you perceive the role of private sector in this all scenario?
Well, the discussion of the role of the private sector in the development sphere is a very big ticket agenda item. What's happened over the years is that Pakistan has thought that it's running a welfare state where health and education and other social services are given free of cost. That's what's there in theory. But over the course of years, what's happened is that public funding for health and education and other social services has dwindled, and there has been a burgeoning of the role of the market in these corresponding areas. Now, these two factors, when they are coupled with a lack of transparency in governance, actually really spell disaster. So what you see across the stream of health and education and other services is that teachers don't go to public schools, doctors will not go to basic health units, they will moonlight in the private sector, they will charge fees as they please. There is systematic pilfering of all the resources from the supply chain in the public system, whether there are medicines for BHUs, whether there are books for children in government schools. And on the other hand, you see a burgeoning of the market, which is charging costs totally unregulated, which is delivering quality across a spectrum. Of course, there's some very good services by the private sector also, but at the other end of the spectrum, there are all kinds of things by unqualified providers in the health and education and social services sector. So basically, getting the public system to get the entire system to deliver on public endpoints creates a number of imperatives. You need to harness the potential of the market. And in order to harness the potential of the market, uh, you, a government needs to have regulatory capacity. In Pakistan, we have no sense of documentation as far as private health providers are concerned, or as far as private education providers are concerned. So we are really very far from creating that enabling um, regulatory environment where the outreach of private service provision in the development sector can be harnessed. It is an imperative, in systems like ours, which are mixed for the development sector, for health and for education and for other services. It's an imperative, but the government does not have the capacity to harness their potential, because it's not something which is going to happen with the creation of a commission or with a certain policy directive or with the enunciation of a law. You require a number of legislative, institutional and HR changes, and changes in norms at different levels of management to be able to do that. And this is just one side of the picture, because you put a question about the role of the private sector in development to me. Service delivery is just one part of the spectrum. There are so many other aspects of harnessing private, or let me even broaden that further, non-state, the potential of the non-state sector for assisting the government in delivering on public endpoints. I mean, this whole issue of how do you harness innovation, through reaping the benefits of technology, and how do you ease barriers to intellectual property, which is getting into the private sector domain. I mean, how, for instance, in the health sector, do you get the private insurance market to work for equity endpoints? How do you get private actors to serve on public sector governance boards, so that, in the interest of transparency and accountability? How do you get NGOs like LEAD, for instance, or Heartfile, or many others like us, to assist the government in an environment of dire capacity constraints, to help formulate policy? And many of us are actually doing it. Whether it's recognized or not is besides the point. So there is this whole spectrum of private sector engagement, and I could go on and on. For instance, there are HR constraints, but you need to incentivize the private sector to step up production of that HR. I'll just give you a small example. There's a shortage of nurses. The government could give an incentive to the private sector to train those nurses. But such policy initiatives are not very simple, because when you will incentivize the private sector to produce nurses, you need to have some level of retention regulation to retain them. So across the stream of public-private engagement, there are different opportunities, in service delivery, in training, in policy formulation. These are some of the things I've talked about. This whole area of infrastructure, where private investments can be very, very conducive. But again, there's so many policy imperatives at the capacity end. Because always remember, a weak government cannot overcome its own weaknesses by yoking the private sector on its own uncertain cards. Governments have to have a vision. They have to understand what they want to do. They need to have the capacity to engage non-state actors. They need to have regulatory capacity. And then, of course, they can harness the potential within the entire ambit of stakeholders outside of state arrangements.